All right, good afternoon, everybody. Welcome to the BACP webinar on Chicago's reopening plan for health and fitness centers. My name is Isaac Reichman. I'm the Director of Public Information at the Department of Business Affairs and Consumer Protection, BACP. I have received confirmation that folks can hear me, so please adjust your volume and to make sure that you can hear me clearly. Couple points of housekeeping before we get into the webinar. This webinar will last 1 hour. If you have any questions over the course of the webinar, please submit them via the chat function. There is also a Q&A option, but for me to handle questions as they come in, it is much better for them to be submitted through the chat function. Again, if you have any questions, submit them through the chat function. I will do my best to pause at a couple times over the course of this webinar, and then again to have time at the end to answer questions. But we do have a high number of attendees today, so I will be unable to answer, or while I hope to answer every question, I may not be able to answer every question that comes in. And on every slide, not on this home slide, but on every other slide, you will see, and I'll jump into our first page, you will see an email on the bottom, bacpoutreach@cityofchicago.org. If any questions that I do not get to, or I am unable to answer for any reason, please submit them as a follow-up to that email, bacpoutreach@cityofchicago.org. It may be the case that some questions come up today that I am unable to answer. So if you send that question to that email, I can help get that answer as soon as possible. I know folks have a lot of questions right now. Additionally, your microphone should automatically be on mute. We do have a high number of attendees, so we will, again, questions should be submitted through the chat. Do not adjust your microphone. And finally, before we get into the details of this webinar, which is all about the reopening plan for health and fitness centers in Chicago, I do want to talk a little bit about the mayor's announcement this morning. I hope that folks were able to catch the mayor's comments this morning, or were able to tune into some news after that. But the mayor announced that we are still planning on moving forward and moving to phase 3 tomorrow, June 3rd. Let me repeat, we are still planning on moving to phase 3 to cautiously reopen starting tomorrow, June 3rd. We know that this is an incredibly difficult time for so many businesses and residents throughout the city of Chicago. And the mayor and the health commissioner and the police commissioner took the time necessary to evaluate the health metrics, the public safety risk, and to have numerous conversations with business groups and businesses themselves to determine whether or not to push back the reopening date. And they determined that we will be still reopening starting tomorrow. Now, let me also talk a little bit about the current situation to make sure that all businesses know that the city, various different city agencies are here to support businesses during this critical time. We at BACP are working very, very closely, numerous times every day, with our chambers, with our local chambers of commerce and our business service organizations to answer questions, to address issues, to send cleanup and board up services out to folks that need them. We're also sharing information. We're sending a newsletter out daily, providing updates and information to the business community. So if you're not getting that daily email, I do recommend that you send an email to bacpoutreach@cityofchicago.org, and we'll make sure that you are on that email blast. We know this is a constantly changing scenario, and we want to make sure we're sharing that information as quickly and as completely as possible. So if you are in need of any services, have any need of support, the best thing you can do is reach out to your local chamber of commerce. And you know what? I'm going to type the website in, chicago.gov/NBDC is where you can find a list of the local chambers of commerce and business service organizations that the city partners with. You can also submit questions and requests to 311. And as the mayor announced today, we are working on additional recovery supports for businesses that have been impacted by the current situation. More information about that will be coming in the coming days as we work to put that together. But again, we want you all to know you can always reach out to BACP Outreach if you have any questions. Me or someone from my team will follow up. We just want to make sure that the avenues of communication are open. And again, however, we are planning on cautiously reopening. We are planning on still moving forward to phase 3 tomorrow, June 3rd. Again, if you have any questions related to the current situation, everything going on right now, please do not hesitate to reach out, and we will make sure to get those answers. And the best thing you can do is really to work through your local chamber. And if you have any questions about whether, you personally as a business can and should be reopening starting tomorrow, if you have any public safety concerns, do feel free to reach out. We also recommend, again, working with your chamber, working with your local police district, because every community is dealing with something a little bit different right now. So with that introduction, I'm going to jump into the agenda for today. So again, today we are going to be discussing what phase 3 looks like for health and fitness centers. Again, phase 3 is cautiously reopening. I'm going to talk a little bit to give an overview of phase 3, how we got here, what it means. I'm going to talk in detail about the health and fitness reopening guidance, and I'm going to provide an overview of other reopening resources. Let me plug this website. I'm going to probably say it 20 different times over the course of this presentation. If you have not done so already, please visit chicago.gov/reopening. This is a very detailed, organized website that has everything you need to know about the reopening in City of Chicago, including industry guidelines for health and fitness in detail and all the other industry sectors as well. I saw a question already come in. Will the guidelines be translated into Spanish? Yes, almost all the guidelines have been translated into Spanish as of now. I know they're working very quickly to try to get the rest of them. So I'm not 100% sure if the health and fitness guidelines have been translated yet, but they will be shortly if they're not. But most of the guidelines so far have already been translated into Spanish, and they will be translated into other languages as well. So really quickly, before I get into the details of what phase 3 looks like for health and fitness, I want to talk about the health metrics and what phase 3 means for the whole city and how we know that we're ready for phase 3. First, let me provide an overview of phase 3 because many of you are business owners, but you're also residents and want to know what this means for you. So phase 3 means cautiously reopen. So we're shifting tomorrow from our stay at home into phase 3, cautiously reopening. And for what it's worth, the city slogan is changing from stay home and save lives to be safe, Chicago. So tomorrow we are thoughtfully and cautiously beginning to reopen. The mayor has used this metaphor numerous times, and I will repeat it. This is a dimmer switch. This is not flipping on a light switch. We are cautiously, slowly, and carefully reopening. So what does this mean from work? Non-essential workers can begin to return to work in a phased way, and certain businesses can begin to reopen with appropriate protections. Again, I'm going to go into detail on this, but this means that health and fitness centers can reopen under very, very strict guidelines, limiting to one-on-one training and to outdoor classes, which we'll go into detail on the next few slides. What does this mean for your life? This means when you meet others, you should be physically distancing and wearing a face covering. Face coverings are absolutely essential. You'll find across the guidelines that face coverings are required. Physically distancing, that usually means 6 feet. You'll see throughout this, 6 feet is that magic number for social distancing. Non-business social gatherings are limited to 10 people or fewer. So that means you can have social gatherings with friends, with family, be safe, socially distance as much as possible, and limit them to 10 or fewer people. And public amenities will begin to reopen in a phased way over the course of phase 3. what does this mean for your health? I want to reiterate, the health commissioner has said this numerous times, and I want to make sure this is abundantly clear. If you are sick with symptoms of COVID-19, you should be staying home. That's the case today, and that's the case tomorrow. That will be the case a month, 2, 3, 4 months from now. That will not be changing. So if you feel sick with symptoms of COVID-19, you should stay home, even as we're reopening. You should really be physically distancing yourself from vulnerable populations. That means elderly, folks with underlying conditions. Regardless of what else is going on, that should still be the case. Finally, you should get tested if you have symptoms. This is, we've done, the health department has done remarkable work expanding the testing. I'll talk a little bit more about that in the next slide. And we're at the point where if you are experiencing symptoms, you can and should be tested. And on the chicago.gov/coronavirus website, you can find an overview of how to go about getting tested, where you can find community testing centers. So now, real quick, one more slide before jumping into the specifics of the industry guidelines. I want to make sure that this entire conversation is couched in the health metrics. The reason why we're ready to transition to phase 3, as the health commissioner mentioned this morning, is we have met all of the metrics that we have set for us to be ready to transition to phase 3. This is not the mayor, the health commissioner. They did not randomly pick a date on a calendar. They didn't say, hey, June 3rd makes sense. That's going to be a really nice day. They chose health metrics and they waited until we met those terms. So what are some of those health metrics? And I won't go into too much detail on this. I'm not a health professional. I'm not the health expert. So if you have any health related questions, feel free to submit them to this outreach website and to the outreach email, and we'll forward them to the health department, connect you with the right folks in the health department to get those answers. But again, I'm not the health expert, so I will do my best to answer questions, but may not be able to answer every question. I see a number of questions coming in. I just want to let you all know that I will be answering those questions. They will be covered in the next couple slides. And if I don't answer them on the slides, I will make sure to answer them as we're when we have time. So I just want to let you know I'm not ignoring the questions that have come through. So the first real criteria we're looking for is a declining rate of new COVID-19 cases. And we've been very happy to report that we are seeing this across ethnicities, across neighborhoods, across different settings. We are seeing a declining case incidence. So a declining rate of positive tests, declining rate of cases resulting in hospitalization, ICU admission, or death, and a decline in the proportion of emergency department visits that are for flu-like symptoms. Next, we are making sure we have adequate hospital capacity. This is the goal of this is to make sure that if there were to be a spike, we are prepared. And we're happy to say that we have been prepared this entire time. We have never used up our capacity of hospital beds, ICU beds, ventilators. We've been working very hard to get adequate testing capacity. We're now performing over 5,000 tests a day in the city of Chicago, which is wonderful. That means that we are getting all the information we need to truly understand and treat this disease. And also our positivity tests. Our goal is under 20% total positive tests, and we're at that point. Our goal is also under 30% at congregate settings, meaning nursing homes, jails, places like that. And also under 15% positive tests at community settings, in general, folks around the community. Again, happy to say, Health Commissioner just announced that this morning, that we have reached those goals. Finally, our goal is to make sure we have response capacity. And a little bit of the guidelines for the health and fitness industry, we'll talk about this contact tracing, community investigations, things like that. And we do have a plan in place for that. So again, before getting into the specific industry guidelines, I want to reiterate what the mayor, what the health commissioner has said. We are not out of the woods yet. We have made significant progress, and I know our business community is the reason for that. You guys have been asked to do so much, to take such significant sacrifices, and because of that, we have seen so many positive results. But we're still having hundreds of new cases every day. We're still having people die every single day from COVID-19. That's the case today. That's going to be the case tomorrow. So I want to reiterate and stress, we are not out of the woods when it comes to COVID-19. And the reason why we've developed and are sharing these guidelines is to show you, the business owner, how to open and how to protect your employees and your customers. The last thing we want is to have an outbreak because we reopen too quickly and too out of control. And the mayor and the health commissioner have been clear, we're not going to be afraid to go back to phase 2 if we have an increased outbreak, if that curve starts to go up. So it is your responsibility as business owners to make sure that you are taking these steps to protect your customers and to protect your employees. Great. So what is reopening under phase 3? This list, you'll see the list of the industries that will be reopening under phase 3. And let me be clear, they will be reopening under strict guidelines. So childcare will begin reopening. This means childcare centers and home daycares. City services will be reopening in phase 3. To clarify though, the city services will begin reopening on June 8th. That means your parks and your libraries will begin reopening on June 8th. Office and real estate, office-based jobs, professional services, real estate services. Hotels and lodgings, outdoor attractions. That means boating can begin reopening, but let me be clear, the lakefront will not be reopening under phase 3. When it comes to businesses, retail stores, things that were non-essential previously can now reopen. Personal services, hair, nail salons, barbershops, tattoos, tattoo parlors can begin to reopen under very strict guidelines. I know that haircut you've been putting off for 2.5 months, the hair salons will now be reopening. And also health and fitness, focus for today under strict guidelines. And then finally, restaurants and coffee shops for outdoor dining only. And if you have any questions about food services, that last one there, I'll be doing a webinar today at 4 p.m. specifically for the food service industry. So let me stay in here for just 1 second. A couple things that will not be reopening under phase 3. Again, we're focusing on health and fitness, but I want to make sure I'm kind of providing the overview so you all understand it. Schools will not be reopening at this point. Bars and lounges, breweries that only serve alcohol and no food will not be reopening. Large event venues will not be reopening. And museums, other sort of outdoor attractions, museums will be reopening in phase 3, but not at the beginning, not at June 3rd. Youth sports, youth activities will be reopening later on in phase 3, not right at June 3rd. Great. So what do we mean by health and fitness? I know many of the questions we got since the industries were announced last week have been questions about what exactly falls into what industry. So here's an overview of what we mean when we mean health and fitness. Obviously, the obvious ones, exercise fitness centers, gyms, things like that. Also strength development centers. And also boutique fitness studios, dance studios, cycling studios, strength and conditioning studios, yoga studios, things like that will be considered under health and fitness and can reopen, again, under strict guidelines that we will go into in detail. If you have, for example, other sort of industries also at your center, for example, maybe you have a fitness center, but also have, you're also serve and sell food there, then you need to follow the guidelines of that other industry for that other activity you're doing. So for example, if you have something like a restaurant, coffee shop, things like that at your fitness center, you need to follow the food service guidelines for that portion, which means outdoor dining only. Great. Also, if you aren't 100% sure what exact industry you fall in, there's a couple things you can do. First of all, as always, any questions you have, you can send them to BACP outreach@cityofchicago.org and we will get you that answer. Second, we will be posting, and the mayor talked about this today, should be up on our website, chicago.gov/reopening. There'll be a long matrix list of all the different businesses you can think of and what industry they fall into and whether or not they can be reopening under phase 3. Finally, part of this is leaving it to you, the business owner, to determine what guidelines you should be following. You understand your business the best. And if you kind of fall within one or the other, not 100% sure, again, you can consult that matrix. You can reach out to us for a question, but ultimately you can and should be using your judgment to determine what industry you fall into. Because again, this is all about keeping you and your employees and your customers, your clients safe. We want you to use your best judgment on how to go about doing that under these guidelines. So what can you find on the reopening website? You can find industry guidelines developed based on the health department, CDC, global benchmarks, developed in conjunction with industry leaders across different industries. You'll also find an opportunity to self-certify and to complete a questionnaire developed on your industry guidelines to help you prove to your customers and your employees that you are following the guidelines you need to reopen. And then finally, there are additional resources, national resources, state resources, as well as posters that you can download to print at your location. Again, questions can be submitted to BACP Outreach, or you can call the COVID call 311, submit questions to 311. So all of the guidelines are split up into 3 different categories: healthy interactions, safe spaces and conditions, and operation resilience and monitoring. I'm going to provide a quick overview that provides a general overview of all the guidelines across industry. First, the guidelines require social distancing. Again, your magic number is 6 foot of distance. Gathering size is limited to 10 people. Now, let me clarify, that does not mean you can have more than 10 people within your location, but any one individual gathering of people all gathered to do the kind of exact same thing together should be limited to 10 or fewer people. So outdoor classes should be limited to 10 or fewer people. Protective gear, this means face coverings for everybody. And then hygiene requirements should be in place for employees and for clients. Safe spaces and conditions. Every industry requires at minimum a self-screen of employees before they enter the location. Now you can do more than that, but at minimum, workers should be asking themselves a series of questions to make sure that they do not have COVID-19 symptoms, to make sure that they do not have anything that could be spread to other folks. You need to establish cleaning standards and have visual guidance set up around your location. And then you should be setting up the workplace in order to keep everybody safe. And again, I'm going to go into a little bit more detail on what that means. You also should be taking steps to ensure operational resilience, that we are safe into the future. And I'll go into a little bit more detail on what that means. So I know it's been a bit of a long introduction, but I did want to make sure to give all the context. So if you go to chicago.gov/reopening, you will find an overview, a picture for this health and fitness industry and what it'll look like as it is reopening starting tomorrow. So what are the most important things you need to know? First, and this is very important, and I want to make sure to emphasize this, and hopefully folks understand this. Indoor use at your health centers and fitness centers needs to be limited to one-on-one training only. So what does that mean? That means you cannot have larger classes with more than one-on-one training. You cannot have indoor classes. And you cannot have people working out independently within your fitness center. So indoor use is restricted to one-on-one training only. Let me provide a little bit more explanation of what that means. What that means, that does not mean that you can only have one trainer and one client inside your location. You can see it in this image here. We have 3 different trainers and 3 different individuals. but it means that every client that is working out needs to have a one-on-one trainer with them. Let me reiterate again. You can have multiple, you can have more than 10, you can have more folks within your facility, but you need to make sure that they're all training one-on-one with a trainer. And ancillary accommodations should be closed. This means showers, locker rooms, things like that should be closed. The entire space and the equipment must be frequently disinfected by employees. And participants and employees are required to wear face coverings at all times, including during physical activity. You should have sanitizing products available for employee and client use. And finally, you can have outdoor classes, but they are limited to no more than 10 individuals. Great. So I'm going to take a quick break. I'm going to go into all of these in a little bit more detail. I'm going to take a quick break to go over and answer a couple questions. First, I see, are face coverings required for outdoor classes where people are 10+ feet apart? But yes, face coverings are required for outdoor classes. Wanted to clarify this. Gyms, health centers can reopen under phase 3, which is starting tomorrow. So the date for phase 3 is tomorrow, June 3rd. Other things will be opening later in phase 3. Health and fitness centers can reopen under these guidelines we're going over right now. So one question, what is the rationale between having 10 people inside, one trainer and one client groups, 10 people working out individually within the facility? The reason why, and I'm not the health expert, so I can't go into too much detail on the health reasons behind this, other than to say that these were recommendations from the health department. But the goal of having these one-on-one trainers is to ensure that things are properly sanitized and that people are not kind of interacting with other and that distance is kept throughout the time. So we know that fitness centers have a high propensity to potentially lead to transmission of the disease. So we want to make sure that clients are working out kind of closely with a trainer who understands these rules. Great. So can 10 people exercise together inside with masks and 6 feet between them? Yes. Let me clarify. You can have more than 10 people working out inside with masks and 6 feet between them, provided that they are one-on-one with a trainer. That 10-person gathering limit is not limiting the total number of people within a facility. That's not something we're considered a gathering. A gathering would be people gathered in close locations for the same purpose. So if you have a large gym that can fit way more than 10 people, comfortably 6 feet apart, you can have more than 10 people working out inside, again, provided they have a one-on-one trainer. Great. So a question I just want to remind everybody, we are still planning. The plan, as the mayor announced this morning, is still to move to phase 3 starting tomorrow. So a question about when locker rooms and showers are projected to be opened. That's something that is still in consideration. The team is working tirelessly to provide additional guidance as soon as that is ready. We do not have a date at this point. So I saw a couple other questions come in. Let me move on and go into a little bit more detail because I think they still will be covered. Great. Questions about bathrooms. Bathrooms are not considered ancillary accommodations. You can have a bathroom inside. So again, let me go into these in a little bit more detail about what all of these means, and then I'll answer the other questions when I have time at the end. So social distancing, you need to ensure at least 6 feet between individuals and close choke points. So even during that one-on-one training, you need to make sure 6 feet of social distance. So, you know, if 2 machines are within 6 feet of each other, you should not have people using those 2 machines at the same time. You should also be providing adequate space outdoors for cardio and class exercises. Again, outdoor classes can have can have up to 10 people, but please do maintain the 6 feet of social distancing. You should, indoor, again, is limited to one-on-one training. Your total indoor usage should be limited to 25% capacity. And I know there's a little bit of confusion and there's a lot of different numbers being thrown out. So that 10 limit, you can have more than 10 people within your facility. Your limit of people within the facility is 25% of your typical capacity. And then again, those folks should be limited to one-on-one trainings. Locker rooms, saunas, steam rooms, childcare, lounges should all be closed to prevent gatherings. And outdoor fitness classes should be limited to no more than 10 individuals. Just saw a great question come in, and I'm going to stop for this because this is an important clarification. What if your building does not have a capacity number? Many buildings, many businesses do not have an occupancy placard, do not have capacity. In fact, the majority of businesses in the city of Chicago do not know and have that capacity number. So what we're saying is that 25% capacity should be used as a guidance for the business owner to determine how many people you should let in. You should consider what would your typical capacity be based on your allotted space, and then you should take that down to 1/4. Take that down to 25%. And so that is what you should be using. This is, we're not giving out a strict number. This is exactly how to calculate it. It should be, business owners should be making that calculation themselves. Another question that comes in, and this is an important point of clarification on that 6 feet of distance. If you have impermeable barriers between things that are within 6 feet, that can suffice. This is the same guidance we're giving hair salons, for example. If your chairs at hair salons are within 6 feet, but you have an impermeable barrier between them, that works. So if you're able to set up if you're able to set up your machines to have an impermeable barrier between them, that can work as well. Again, outdoor fitness classes should have no more than 10 individuals. Great. You should also be ensuring protective gear is worn by all employees and customers. Face coverings should be worn over the nose and the mouth at all times by participants and trainers. Exceptions can be made for people with medical conditions or disabilities. Should also be ensuring regular sanitization of hands and high-touch areas by providing sanitizing products for customer use, soap and water, hand sanitizer. You should be decommissioning water fountains unless they're used to fill up water bottles. You should be encouraging employees to complete health and safety trainings related to COVID-19. This is the best training that we recommend, is one put together by the World Health Organization in order to make sure they're trained before returning to work. And you also should be requiring employees to wash hands before and after every one-on-one training or close contact with other individuals. So I'm going to take a quick break to answer a couple questions that have come in before getting into the next slides. So questions about membership sales and new customers coming into the club to join. Yes, that stuff can resume. Again, you can be reopening under these guidelines. Great. Outdoor spaces for group classes. This should be, I know this isn't perfect for everybody, but this should be private spaces. Once the parks reopen, we will have an opportunity for folks potentially to use the parks, but we will be providing more information there. And I got a couple questions that come in about the capacity. So if you have so regarding the capacity, it really should be, think about the space that is being used at that point in order to calculate the capacity. For example, if everybody is within one small room, you should be considering that capacity of that small room. Think about the way that, COVID-19 can transfer between people. So you should be really considering each kind of different choke point, considering that individual capacity. I saw a couple questions come in about using dividers. That is something that, as I said, can be done. How can we ensure that clients are following the gym protocol? That's why we have this one-on-one training in place. Your employees should understand this protocol, and they should be making sure that your clients are following them. Questions about why retail stores, Home Depot, grocery store, things like this, do not have the same guidelines. This is something that's come from the health department, and a lot of this is all coming from our health department. And there's different risks at retail stores than there are at gyms where everybody is using the same equipment and all in the same space. So we do understand that this is different than other guidelines, and we do just want to make sure that, to clarify that this is all coming from our health department and their metrics. So let me go over in a little bit more detail some of the other guidelines. So entry access. You should be implementing screening measures for employees and customers prior to entering the establishment. So what does this mean? Employees should be self-screening to ensure that they do not have symptoms of COVID-19, and they should not be reporting to or allowed to remain at work if they are exhibiting symptoms or reporting that they are ill. So this does not need to be a temperature check, but they do need to do a self-screen, and language for this self-screen, which you can share with your employees, can be found on our website, chicago.gov/reopening. You should be ensuring that participants are coming to the facility dressed in exercise clothes. So you do not need to do a specific screening for participants, but you should make sure that they're coming fully dressed in exercise clothes. You should be establishing daily cleaning standards for spaces and high-touch items. So you should have convenient and available disinfecting supplies for sanitation, and you should be requiring patrons to self-sanitize using equipment whenever possible. You should also discourage sharing instructor equipment and encourage staff to bring their own equipment wherever possible. So if you have staff that are using equipment, part of their classes or part of their training, you should be discouraging them sharing that equipment with other staff and with clients. You should also be cleaning and disinfecting all shared equipment after each use. Hopefully that's something you have in place anyway, not just during this time. You should be providing visual guidance on hygiene standards and entry requirements. So that means you should be posting signage throughout your facility. And this is signage that you can find on our website, chicago.gov/reopening. You should also be posting social distance guidelines, things perhaps markings, tape on the ground to ensure that people are 6 feet apart. You should also be modifying your workplace conditions to minimize interactions. You should be rearranging, or as I said earlier, cardio equipment that is within 6 feet is that you don't have a barrier between them, and so cardio equipment that doesn't have a barrier between them, you should make sure that you're either decommissioning your equipment or making sure that people aren't using equipment that is within 6 feet. Should also be increasing airflow as much as possible. According to CDC guidelines, you can find a link to them on our guidelines. We strongly encourage folks to open doors, open windows. Maximizing airflow is something that can be very, very useful to decrease the spread of COVID-19. And then this is our last page to go over those guidelines in detail. You should be limiting in-person work where possible. A lot of folks, myself included, we've transitioned over the last couple months to online meetings, online trainings, things like that. Just because we're opening up starting tomorrow doesn't mean we should stop all those great habits that we've developed. Again, this is a dimmer switch, not a light switch. So you should be minimizing in-person interactions as much as possible. You should also be minimizing client overlap. You should just have one client per employee without those schedules overlapping. You should also promote shifts that kind of overlap and are not. You should promote shifts for workers that are not all starting and stopping at the exact same time, promoting A and B shifts. You should also be limiting travel for businesses. So if you have multiple locations, you should be limiting, if possible, the staff travel across those different locations and really have them stick to one location. Finally, you should be following health department and CDC guidance for testing and tracing protocols. Please read this in detail on the guidelines. And if employee does contract COVID-19, which very well might happen, please follow the CDC guidelines before returning to work, and please clean and disinfect the workplace according to those guidelines. Any employee who's had close contact with a coworker or another person who is, diagnosed with COVID-19 should self-quarantine, again, according to those CDC guidelines. And if you're aware of 2 or more cases possibly associated with an establishment over a 14-day period, you are required to report those cases to CDPH. So now, again, I've got a couple questions coming in, and I will do my best to answer them. I will say again, if I'm unable to answer all of these questions, either because we do not have time or I do not know the answer, I will make sure to get back to you. Please send those emails, send those questions to bacpoutreach@cityofchicago.org. So I do want to clarify one question. Are indoor classes permitted during phase 3? No. During phase 3, indoor classes are not permitted. Just got a question confirming that clients are required to wear face coverings during the training and outdoor sessions. Yes, this is a requirement of our guidelines for clients to be wearing face coverings. I got a question. Are we required to provide masks? Employers are required to provide masks to their employees, but they are not required to provide masks to their clients. But that is something, again, that they are required to wear. So it's encouraged if you have the opportunity to do so. Question, are we required to screen clients for COVID-19, or is that optional? There is not a specific requirement. I'll go back to the screening section. You should be screening employees, at least doing a self-screen. You're not required to screen clients. That is something that is optional. I got a question to clarify the 6-foot rule versus barriers. So this is something across the board on all different industries. So I think it's an important point to clarify. If you have an impermeable barrier, something that is actually and truly impermeable, and COVID-19 or anything else cannot be transmitted through it, then you do not need the 6 feet distance. That, imagine there's a wall between someone. This does the same thing, and you are not required to maintain that 6-foot distance. The 6-foot distance is if you do not have a barrier between people. I had a question for the link for the World Health Organization training. Please, I do not have that link right now. I believe it is on the website, which I'll put in the chat again, chicago.gov/reopening. If it is not, please send me an email at BACP Outreach, and I'll make sure to send you that directly. Great. So once Chicago enters the next phase, will studios be permitted to hold indoor classes? That is something that we're hopeful for. We do not have the specific guidelines for phase 4, but I promise we will share those as soon as possible. Give me 1 second to read a couple of the other ones. So I got a couple questions related to the current crisis, the current situation going on. For example, are outdoor classes still an option at this moment? Again, I want to reiterate, the mayor has made it clear we are shifting and ready to go to phase 3 tomorrow. Now, that does not mean that let me clarify. You, the business owner, should be evaluating whether you are comfortable opening up, whether you are comfortable having outdoor classes. It will be allowed beginning tomorrow, but it is obviously not a requirement that you open starting tomorrow. So we recommend, because every neighborhood is different right now, we recommend working closely with your local chamber of commerce and with your local police district to determine what you should be doing. You know, we've heard constantly from business owners, even business owners in the most impacted areas of Chicago, that they want to reopen starting tomorrow. So the mayor's made it clear we will not be pushing back that date. Obviously, many businesses will not be reopening tomorrow, and that's something we truly understand. But it is an option, and that is something for you, the business owner, to determine. And we recommend that you work closely with your police district and your chamber in order to make sure that you are doing this properly. Great. So I had a question, do I have to make sure my clients are wearing masks even if they are 6 feet apart? Yes, that mask requirement is in place even if you are 6 feet apart. Okay. I had a question, and I do understand that this is confusing, that one-on-one trainings inside are not limited to 10 people. And this is kind of getting to that definition of what we consider a gathering. You know, we consider a class where everybody is there for the exact same reason to be a gathering. But if you have a large gym space and you can maintain, and 25% capacity is more than 10 people, then you can have more than 10 people. Because we're not, you know, if people are all working out separately on different machines with one-on-one trainers, that is not considered a class. I got a question, are members able to work out in a club without having one-on-one training? No. Again, any indoor services should be offered only with one-on-one training. Are pools allowed to reopen with one-on-one training? That's a great question. Yes, pools can reopen as under with one-on-one training. You should be, and I think, and don't know if this is something I specifically said, other non-contact sports can, you know, reopen indoor, indoor non-contact things can reopen with one-on-one training, or outdoor, provided that they're under that 10-person gathering. Tennis, for example, you can be reopening. Great. I got some questions about phase 4 and what exactly will be a part of phase 4 that we will, we do not know what will be part of phase 4. I do apologize. I wish I could give you more information. We don't have that information at this time. I got a question about notification about folks that have had COVID-19. Can you please submit that question via email, and I'll follow up with the health department to make sure to get you a proper answer. I know health department has specific guidance on that, so can you please submit that question via email, and I can get you an answer there. Great. Virtual instruction, does that count as one-on-one training? We really, if you're in person and you're you're in the location, you really need to have that one-on-one person there monitoring them. Right. Again, I had another questions. When will we relax this mask requirement? As soon as we have more information, I promise I will be sharing those. I got an excellent question. What about 24/7 access fitness studios? Does that mean we need to limit our hours now? Due to the curfew. So as many of you know, there is an existing curfew in the city of Chicago right now from 9 p.m. to 6 a.m. And that is in place until further notice. As soon as that is lifted, we will make sure to be communicating that out. So folks should not, please, you should be restricting access under that curfew to 9 p.m. to 6 a.m. That's really across the board, across the city. You know, we're hopeful that we get out of that curfew soon, and we will be communicating that as soon as possible. Right. I know there was a couple questions. I do want to get to my last couple slides. I'll do my best to answer a couple of the other questions that have come in, but I will be, again, submit any additional questions to BACPoutreach@cityofchicago.org. So I want to remind folks about the Be Safe Chicago pledge that they can take on the chicago.gov/reopening page. I strongly recommend all businesses to go to this website and take this pledge to Be Safe Chicago. This, folks that are in the health and fitness industry can review all these guidelines in detail and pledge to follow the guidelines throughout phase 3. And what this does, you'll then get basically we're calling it a self-certification. You'll then get a little badge that says Be Safe Chicago. We also have something we just added. You have the opportunity to get something specific for your neighborhood. Be Safe Chatham, Be Safe Little Village, Be Safe Lincoln Park, something that you can post, to take a little bit of pride in your neighborhood as well. And what this does is two things. First of all, it tells your employees that you know the guidelines and you are doing, and you know what you need to do to keep them safe. It also tells your customers that same thing, that you have reviewed these and that you are going to be reopening safely. Finally, I want to talk about personal protective equipment. I know that this is a question that many people have. We have lots of talk in here about how to, the hand sanitizer requirement, protective shields if necessary, face masks, things like that. And a lot of small businesses I know want to know how to get that. So if you're not aware of this resource already, recommend that you check out the Chicago PPE Market at www.chicagopppemarket.com. This is a place created by a local startup called Repley for small businesses, CBOs, and not-for-profits to secure affordable supplies from verified sources. So you know that you're getting what you need at reasonable and competitive prices. So if you haven't checked out this site yet, I recommend that you do so now to make sure that you're prepared. We want to make sure that folks have their resources. And very quickly before wrapping up, and that site, let me type it into the chat as well. It's on the slide here, but it's chicagopppemarket.com. Before wrapping up and before getting to a couple additional questions that have come through, I want to talk a little bit about enforcement. These guidelines these are guidelines for this industry to reopen and to reopen safely. And a lot of the language in the guidelines says, do this if possible, and read the language closely to see what exactly are those guidelines. But let me emphasize that this is something that will be enforceable, and this is something that we are taking very, very seriously. So, businesses, for example, that just open up fully are opening up their gym, that will not be tolerated. And that is something that we will be enforcing against. Or classes with 30 people in them. Buildings that are packed to their capacity. We will be enforcing against that. And we have been, I know a number of our investigators are actually in on this call. And this is something, we've been enforcing the stay-at-home order since it came out. And we will continue to enforce this. Some things are guidelines, but the overall social distancing, the overall restrictions on just one-on-one training and outdoor classes is something that we will be taking seriously. So I do just want to emphasize that. We got a couple minutes left, so I'm going to leave this slide up so you can see the link to the PPE market. And I saw a couple additional questions come through. One question, martial arts studios. Martial arts studios would count under the health and fitness center guidelines. So again, they can open up with one-on-one training, or they can open up with outdoor classes with 10 or fewer people. Now, I've seen a couple health-specific questions, additional health-specific questions that come in. Those are things I want to run by the health department because I do want to make sure I'm not giving incorrect answers for something this important. So please, a couple of the health-related questions that I've been unable to answer, please submit them to BACP outreach at cityofchicago.org. So great question. Should gyms allow towel service or should clients bring their own towels? So that's not something that's specifically talked about in the guidelines, but we are so we're not restricting your use of towel services. Now, we're obviously, you need to make sure that these, which you should be doing anyway, that they're washed, not being reused, but there's no restrictions on towel services. Yep. And then should employers provide reusable masks or disposable masks acceptable? Like, we recommend reusable masks, but disposable masks will be acceptable provided that they cover your face and your nose properly. Great question. Is there a place to find all required notices that are expected to be posted in your business? Yes, and I'll put this back into the chat. If you have not visited it yet, please do so. chicago.gov/reopening. You can find all these guidelines. You can also find all of the postings that you're expected to be having up in your location. Great, so it is 1 o'clock. This presentation has been recorded and it will be posted on our Business Workshops website. So any of your colleagues that were unable to attend, or if you want to share it to other folks, we will be posting it hopefully by the end of the day, if not early tomorrow. And I want to thank you all. I know that this is an incredibly challenging time for businesses. We understand that. And we also know that we need to follow the guidance of our health department, of our mayor, and our public safety folks right now. And we're gonna be continuing to communicate with all of you. And I ask that anybody has any questions, any follow-ups, please do reach out to that email there. So thank you all very much.